In the grand architecture of the human body, the feet are often the most undervalued foundation, serving as the silent bearers of our existence from the moment we take our first step to the twilight of our years. For the elderly specifically, the foot is not merely a mechanical appendage used for locomotion. It is a complex physiological terminal where nerves, blood vessels, and connective tissues converge in a density found nowhere else in the body. It is here, at the furthest point from the heart, that the battle for circulation and vitality is often fought and lost. As we age, the forces of gravity and the cumulative wear of decades make the lower extremities a repository for stagnation, coldness, and fatigue. Yet, embedded in the annals of ancient medicine and now corroborated by modern physiological science, there exists a deceptively simple ritual that acts as a potent antidote to this decline: the ginger saltwater foot soak. To understand why this practice is described as miraculous, we must look beyond the surface level of relaxation and delve into the intricate hydrothermal and biochemical exchanges that occur when the aging body meets this specific medicinal solution. To comprehend the efficacy of this therapy, we must first appreciate the anatomical landscape of the target area. The human foot is a masterpiece of engineering, containing 26 bones, 33 joints, and more than 100 muscles, tendons, and ligaments. However, for the purpose of systemic health in the elderly, its most critical feature is its vascular network. The feet are often referred to by cardiologists and physiologists as the second heart. This title is not poetic, it is functional. Venous blood, having delivered its oxygen and nutrients to the tissues, must return to the heart against the relentless pull of gravity. This return journey relies heavily on the muscular pumps of the calf and the foot, which squeeze the veins to push blood upward. In older adults, where muscle mass has diminished due to sarcopenia and physical activity is reduced, this second heart becomes weak. Blood pools in the extremities, causing edema, coldness, and a sluggish circulatory system that burdens the primary heart. This is where the science of hydrotherapy, specifically thermal immersion, begins its work. When an elderly person submerges their feet in warm water, they're initiating a profound thermodynamic event known as vasodilation. The heat from the water transfers energy to the skin, triggering the sensory nerves to signal the smooth muscles lining the blood vessels to relax. As these vessels widen, the resistance to blood flow decreases dramatically. This is not a localized event. Through a reflex arc known as the consensual heat response, warming the feet can trigger a systemic improvement in circulation, influencing blood flow even in the upper body and the brain. However, if heat were the only factor, plain hot water would suffice. The true magic and the scientific complexity lies in the solutes we introduce into this thermal medium: salt and ginger. This transforms a simple bath into a bioactive chemical delivery system. Let's first analyze the role of ginger, or gingiber officinale. In the context of a foot soak, ginger is not a flavoring agent. It is a pharmacological powerhouse. The rhizome of ginger contains potent bioactive compounds, primarily gingerols and showgales. When ginger is crushed and boiled, these compounds are released into the water. For the elderly skin, which becomes thinner and more permeable with age, these compounds are capable of mild transdermal absorption. More importantly, ginger acts as a powerful rubefacient, a substance that causes dilation of the capillaries and an increase in blood circulation. The heat of the water opens the pores of the skin, creating a gateway. The gingerols then interact with the transient receptor potential, TRP, channels on the sensory nerve endings in the skin. These are the same receptors that detect heat. Essentially, ginger chemically tricks the nerves into perceiving more heat than is physically present, amplifying the vasodilatory effect of the warm water without the risk of burning the skin. This thermogenic property of ginger penetrates deep into the tissues, reaching the joints and the periosteum of the bones. Paired with ginger is the second critical component: salt. In this therapeutic context, we are ideally speaking of unrefined sea salt or magnesium-rich salts, though even sodium chloride plays a vital role. The presence of salt changes the osmotic pressure of the water. Human skin is semi-permeable. When we soak our feet in a hypertonic solution, where the concentration of salt in the water is higher than the salt concentration in the body's fluids, a subtle osmotic exchange occurs. This process helps to draw out excess fluid from the swollen tissues of the feet and ankles, a condition known as peripheral edema, which plagues millions of seniors. By reducing the fluid pressure in the tissues, we reduce the compression on the nerves and blood vessels, further aiding the circulation that the heat and ginger have kickstarted. Furthermore, salt acts as an antiseptic and a skin softener. The elderly foot is often prone to dry, cracking heels and fungal infections due to poor circulation and a weakened immune barrier. The saline environment creates a hostile condition for bacteria and fungi, providing a gentle prophylactic effect. If magnesium-rich salts like Epsom salts are used, there is the added benefit of magnesium ions potentially being absorbed through the hair follicles and sweat glands. Magnesium is a natural muscle relaxant and a critical mineral for nerve function. Its presence in the soak can help to quiet the restless twitching of leg muscles, restless leg syndrome, that frequently disrupts the sleep of the elderly. The synergy of these three elements, heat, ginger, and salt, creates a biochemical soup that targets the nervous system. The soles of the feet are densely packed with nerve endings, with traditional Chinese medicine mapping these as endpoints of the body's major meridians, and Western neurology identifying them as rich zones of proprioceptors and mechanoreceptors. When these nerves are bathed in warm, mineral-rich, ginger-infused water, the intense sensory input overwhelms the noise of chronic pain signals. This input travels up the spinal cord to the brain, shifting the autonomic nervous system from sympathetic state, fight or flight, to a parasympathetic state, rest and digest. For an older adult living in a state of chronic physiological stress, this shift is monumental. It lowers the heart rate, relaxes the diaphragm, allowing for deeper breathing, and lowers the levels of cortisol circulating in the blood. It is crucial to understand that the mechanism of action here is not instantaneous but cumulative. Just as the negative effects of aging accumulate over decades, the restorative effects of this therapy build up over repeated sessions. The preparation of this medicinal water is, in itself, a chemical extraction process that must be understood to be effective. Simply dropping raw ginger slices into lukewarm water is scientifically futile. To release the showgales, which are the dehydrated, more potent form of gingerols produced by heat, the ginger must be subjected to high temperatures. This is why the protocol often calls for boiling the ginger first to break down its cellular matrix and release the essential oils and oleoresins into the water before cooling it to a safe temperature for soaking. Segment 6. Having established the intricate physiological stage upon which the ginger saltfoot soak operates, we must now turn our attention to the specific acts of the play, exploring the tangible, systemic benefits that earn this therapy its reputation as a miracle for the aging body. While the sensation of warmth is immediate and pleasant, the true value of this practice lies in the cascade of biological adjustments that occur long after the feet have been dried and the water drained. The first and perhaps most profound impact is on the architecture of sleep, a pillar of health that notoriously crumbles as we age. Insomnia in the elderly is rarely just a matter of a racing mind. It is frequently a failure of the body's thermoregulatory system. To fall asleep and stay asleep, the human body's core temperature must drop by a fraction of a degree. This cooling acts as a biological signal to the brain to release melatonin and initiate the sleep cycle. However, for this core cooling to happen, the body must dissipate heat through its extremities, specifically the hands and feet. The ginger saltfoot soak acts as a master key to unlock this door. By immersing the feet in the ginger-infused hot water, we force a rapid and sustained distal vasodilation. The blood vessels wide open, creating a massive heat exchange surface. As the blood rushes to the feet to be warmed, it actually facilitates the transfer of core heat out to the periphery. Once the soak is finished and the person lies down, the now warm and dilated vessels continue to radiate heat away from the core, allowing the internal body temperature to drop smoothly and naturally. Beyond the realm of sleep, the ginger salt solution wages a potent war against the scourge of chronic pain, particularly the aching joints associated with osteoarthritis and rheumatoid arthritis. In the lexicon of traditional medicine, these conditions are often described as invasions of wind, cold, and dampness. While modern medicine uses different terminology, the underlying pathology aligns remarkably well. Cold corresponds to vasoconstriction and reduced blood flow. Dampness corresponds to fluid retention and edema in the joint capsule. And wind can be likened to the migrating, shooting nature of nerve pain. Ginger is chemically equipped to dismantle this triad. As we touched upon, the gingerols and shogales are potent anti-inflammatory agents. They function similarly to non-steroidal anti-inflammatory drugs, NSAIDs, by inhibiting the cyclooxygenase enzymes, COX-2, that produce pro-inflammatory cytokines. However, unlike pills that must travel through the harsh environment of the stomach, the active components in the foot soak are delivered via systemic circulation and reflex pathways directly to the source of the stagnation. When the feet are soaked, the increased blood flow does not just bring warmth. It brings a fresh supply of oxygen and white blood cells to the joints of the ankles, knees, and even the hips. More importantly, the enhanced venous return helps to flush out the metabolic waste products, such as lactic acid and inflammatory mediators, that have accumulated in the synovial fluid of the joints. The benefits extend further into the cardiovascular system, addressing the silent killer, high blood pressure. There is a common misconception that hot water is dangerous for those with hypertension. While full body immersion in very hot water can indeed be risky, a foot soak, when done correctly, acts as a pressure release valve. Hypertension in the elderly is often driven by increased peripheral vascular resistance. The arteries stiffen and the smaller vessels clamp down, forcing the heart to pump harder to push blood through. By focusing the heat and vasodilation on the lower extremities, which contain a massive volume of vascular capacity, we effectively lower the total peripheral resistance. The blood pools harmlessly and beneficially in the expanded vessels of the legs, drawing pressure away from the head and chest. This reduction in afterload allows the heart to beat with less effort. Over time, regular foot soaks can help to train the blood vessels to remain more elastic and responsive, contributing to a more stable baseline blood pressure. It is a hydraulic principle. If you widen the pipes at the bottom of the system, the pressure at the top decreases. We must also explore the profound connection between the feet and the kidneys, a link that is central to Eastern medical philosophy, but also grounded in neural anatomy. The sole of the foot houses the Yongquan point kidney 1, which is considered the wellspring of the body's vital energy. Anatomically, this area is rich in nerve endings that connect directly to the suprarenal, adrenal, glands, and the renal plexus. Chronic stress and cold deplete the adrenal glands, leading to the fatigue and frailty often seen in aging. The warm, saline, ginger stimulation of the soles acts as a tonic for these glands. By keeping the feet warm, we protect the kidneys from the thermal shock of the cold environment. A warm foot soak supports kidney function by optimizing fluid dynamics, encouraging gentle diuresis, urination, to remove excess water without the harsh forcing of diuretic medication. Furthermore, this therapy serves as a critical booster for the immune system, acting as a preventative shield against respiratory infections. There's a direct reflex arc between the feet and the mucosa of the nose and throat. Everyone has experienced the phenomenon of stepping on a cold floor and immediately sneezing or feeling a stuffy nose. This is because cold feet trigger a reflex vasoconstriction in the upper respiratory tract. Conversely, soaking the feet in ginger water reverses this reflex. It sends a signal to dilate the vessels in the nose and throat, warming the mucosa and recruiting immune cells to the area. Another often overlooked benefit is the improvement of digestive health. In traditional frameworks, the stomach and spleen prefer warmth and dislike cold. A cold constitution leads to sluggish digestion, bloating, and poor nutrient absorption, common complaints among the elderly. Because the feet are the terminus of the stomach meridians, warming them helps to stimulate the digestive fire. Physiologically, the relaxation of the sympathetic nervous system, the stress response, allows the parasympathetic system to take over. This rest and digest mode increases blood flow to the intestines, promoting peristalsis and better enzymatic function. We should also address the dermatological miracle that occurs. The skin of the elderly foot is often a landscape of neglect, callous, dry, prone to fissures that can become portals for infection. The combination of salt and warm water acts as a keratolytic agent, softening the hard keratin of calluses, while ginger provides a mild antiseptic quality. Finally, let us consider the concept of energy conservation. As we age, our metabolic rate slows down. We generate less internal heat. By providing an external source of heat through the foot soak, we are essentially outsourcing the job of thermoregulation for a period of time. We donate heat to the body, sparing its internal reserves. We arrive now at the final and arguably most critical juncture of our investigation into the ginger salt foot soak. Having established the profound anatomical and systemic benefits of this therapy, we must pivot to the practical application. For even the most potent medicine can become a poison if administered incorrectly. The miracle we have described is not inherent in the ingredients alone, but in the precision of the protocol. For the elderly, whose physiological margins for error are narrow, the difference between a healing session and a harmful event lies in the specific details of temperature, timing, and concentration. The first step is the extraction of the bioactive compounds. A common mistake is to simply throw raw ginger slices into a bucket of hot water. This is chemically inefficient. The correct protocol begins with approximately 50 grams of fresh old ginger, old being the key operational term. This ginger should not be sliced, but crushed or smashed. Crushing increases the surface area significantly, breaking the cellular structure to allow for a rapid release of the oils. This crushed ginger must then be boiled in a pot of water for at least 15 minutes. We are essentially brewing a strong medicinal tea. This boiling process is non-negotiable because it facilitates the chemical conversion of gingerol into shogal. The addition of salt follows a specific ratio to create the ideal osmotic environment. We aim for a concentration that mimics the salinity of physiologic saline or slightly hypertonic seawater. A general guideline is approximately 20 grams of unrefined sea salt or pink Himalayan salt per liter of water. The salt should be added to the hot ginger water and stirred until fully dissolved before the feet enter the basin. Undissolved salt crystals can act as abrasives, potentially causing microabrasions on the delicate, papery skin of an elderly foot, which we must avoid at all costs. This brings us to the single most critical variable in this entire equation: temperature. The concept of hot is subjective, but in geriatric care, it must be objective. The ideal therapeutic window for a foot soak is between 40 and 42 degrees Celsius, 104 to 108 degrees Fahrenheit. This is the Goldilocks zone. We must be acutely aware that many elderly individuals suffer from peripheral neuropathy, a condition often linked to diabetes or spinal issues, where the sensation in the feet is diminished. A senior with neuropathy might dip their feet into scalding water and feel nothing, resulting in severe burns. Therefore, the rule of thumb is that the thumb should test the water, or better yet, a reliable thermometer should be used. The duration of the soak is the next variable that demands strict regulation. More is not always better. The optimal duration is between 15 and 20 minutes, and certainly no longer than 30. In traditional medicine, the goal is to induce a slight, dewy sweat on the forehead and upper back. This signifies that the heat has successfully penetrated the meridians and circulated through the entire body. However, if the soaking continues until the person is sweating profusely, we cross the line into depletion. Profuse sweating results in the loss of electrolytes and fluids, which can lead to dizziness, heart palpitations, and a state of exhaustion known as qi deficiency. Timing is also a factor rooted in circadian biology. The most effective time to perform this ritual is in the evening, ideally between 7 and 9 p.m. In the framework of traditional Chinese medicine, this is the time associated with the kidney meridian, making it the most receptive window for tonifying the body's energy reserves. Furthermore, soaking at this time sets the stage for the drop in core body temperature that facilitates sleep. Conversely, one should avoid soaking immediately after a heavy meal. A gap of at least 1 hour after eating is recommended to respect the body's metabolic priorities. We must now address the contraindications, the specific scenarios where this therapy must be modified or avoided entirely to prevent catastrophe. The most significant red flag is for patients with severe varicose veins or deep vein thrombosis, DVT. While mild heat can improve circulation, intense heat applied to veins that are already distended and structurally incompetent can cause them to expand further, worsening the pooling of blood and increasing pain. For these individuals, the water should be kept lukewarm, not hot, and the soak should be shorter, perhaps 10 minutes, followed immediately by elevating the legs above heart level to assist venous return. The second major contraindication involves the diabetic foot. We have already mentioned the burn risk due to neuropathy, but there is also the risk of maceration. Diabetic skin is prone to breakdown. Soaking for too long can cause the skin between the toes to turn white and mushy, a condition called maceration. This weakened skin barrier is an open invitation for fungal and bacterial infections. Another group that requires caution consists of those with severe cardiovascular instability or a history of hypotension, low blood pressure. The massive vasodilation caused by the foot soak can lead to a sudden drop in blood pressure, causing lightheadedness or fainting. The post-soak ritual is just as important as the soak itself. Once the feet are removed from the water, they must be dried immediately and thoroughly with a clean towel. Leaving the feet to air dry causes rapid evaporative cooling, which chills the skin and slams the pores shut, effectively undoing the benefits of the therapy. This phenomenon, known as invading wind cold, can lead to cramping or catching a cold. After drying, the application of a moisturizer or a specific foot oil is essential to seal in the hydration. This is also the perfect moment to put on a pair of warm, breathable socks. These socks act as insulators, trapping the heat that has been absorbed and prolonging the therapeutic effect for hours. In conclusion, the ginger salt foot soak is a practice that embodies the wisdom of simplicity, but its execution requires the precision of science. It is a powerful tool in the geriatric toolkit, capable of turning the tide against the cold, stiffness, and stagnation that accompany the aging process. To the caregivers, the children, and the seniors watching this, do not underestimate the power of this bowl of water. It is not just a foot bath. It is a nightly act of love for your own body. Take this knowledge, apply it with care, and let the warmth flow back into your life, one night at a time. The path to a healthier, more vibrant old age begins, quite literally, at your feet.